For the introduction, Angelman syndrome is named after Dr. Harry Angelman, who first described three children with the syndrome in 1965. After working with the children, he was inspired to write an article after seeing a painting in a museum in Verona, Italy entitled A Boy with a Puppet. The boy's laughing face and the fact that the patients exhibited jerky motions gave him an idea to write an article about this. Later on, the name was changed to Angelman syndrome. In 1987, Alan Maginnis, a physician at the Oregon Health Science Center, identified children with microdeletions of chromosome 15 who were expected to have the Prader-Willi syndrome. However, these children had seizures and severe developmental delay features, which is not expected to be found for that syndrome. It was quickly realized that the found for the syndrome that these children had microdeletions on the maternally derived number 15 chromosome, which means it was genetically related to the mother of the child. Whereas in Prader-Willi syndrome, that deletion was always observed in the paternally derived one, which means it was genetically related to the father of the child.
Cytogenetics of the Angelman syndrome is caused by the deficiency of the E3 ubiquitin protein ligase in the chromosome 15 located in the Q11 to Q13. Take a look at the chromosome in the picture. The abnormalities of the UB3A that can cause the Angelman syndrome involves the absence of the gene, changes in the structure of the gene, or changes in the function or the expression of the gene, and this genetic mechanism can disrupt the UB3A include the chromosome deletion, imprinting error, paternal uniparental disomy, and the UB3A mutation. This means that they will not have enough UB3A protein in the brain. This is the thought that what causes the Angelman syndrome. But there are main causes of Angelman syndrome stated earlier. The imprinting error or the section of the genetic material that usually contains the UB3 is missing from the copy of the maternal. This causes about 68% of the cases. Note that the mother's chromosome 15 is normal and the genetic material is lost during the development of the egg. Second one is the mutation or the child has a change in the DNA in the UBT gene, specifically on chromosome 15, which prevent its expression or function. This causes about 11% of the cases. Third one is the paternal uniparental disomy, where the child inherits two copies from its father. Since the maternal copy is normally needed for the proper expression of the UB3A, there will not be normal levels of the UB3A in the brain. This causes about 7% of the brain of the cases. The, the fourth one is the deletion, where the child has a deletion somewhere else in the chromosome system. It leads to the loss of expression of the mother's UB2 gene, and this causes about 3% of the cases. But in approximately 11% of the cases, the cause is not unknown. And the diagnosis for the Angelman syndrome includes checking for clinical features for Angelman syndrome and performing DNA tests because Angelman syndrome may be mistakenly for autism because of the similar symptoms include hyperactive behavior, problems in hand slapping, and children with Angelman syndrome is highly sociable, unlike child with autism.
Signs and symptoms ng Angelman syndrome includes developmental delays and intellectual disability. Kasama rito babbling o yung pagkakabulol, pagiging bulol, absence or near absence of speech from 6 months to 1 year old. Nagkakaroon din sila ng problema sa paglalakad, paggalaw, or yung pagbabalance. Kasi meron silang problema rin sa pag-coordinate ng voluntary movements. Ang tawag dito is ataxia. Another symptom is laughing or smiling and yung pagkakaroon nila ng happy and excitable personality. Sabi sa research, yung laughing and smiling daw, mas common cause nito is anxiety. And yun yung coping nila para mawala yung anxiety. And usually, mas tumatawa sila kapag may kasama or pag may kausap sila kesa sa wala lang or random na pagtawa. Yung symptom na to, mas tumatalang habang tumatanda or kapag may nararamdaman sila na uncomfortable na health problems or pag may nararamdaman silang masakit. And another symptom is sleeping problems or sleep problems na nagsisimula sa infancy as early as 6 months. And yung ibang patient na merong Angelman syndrome, nabibitbit to hanggang pagtanda. Merong dalawang factor ng sleep problems. Either yung biological factor or psychological factor. Yung biological factor, kasama dito yung pagkakaroon ng poor health or seizures na sign and symptoms din. And pain dahil sa ear infection or constipation. And yung pagbabago-bago ng pag-secrete ng sleep hormone na melatonin. Another factor is psychological factor. Yun yung pagre-rely nila sa parents or caregiver para maging komportable sila matulog. Kasama rin dito yung pag-associate ng mga non-sleep non-sleeping activities sa bedroom or sleeping area.
Now, for the treatment and management of the Angelman syndrome, currently there is no cure for Angelman syndrome. However, children with Angelman syndrome can expect a normal lifespan, and the available medication can only control seizures and should be accompanied by the physical, communicative, and behavioral therapy to manage other symptoms. Like, for example, anti-epileptic medicine to control the seizures. Treatment with other anti-epileptic drugs such as valproic acid and clonazepam is effective, but these medications tend to have less favorable side effects than the newer medicine of the anti-epileptic drugs in Angelman syndrome. Newer anti-epileptic drugs such as levetiracetam, lamotrigine, and clobazam, and to a lesser extent topiramate, appear to be as effective, if not more so, as valproic acid and clonazepam, while offering more favorable side effects. Next is the physiotherapy that may improve their posture, balance, and walking ability. Like it is more also important to prevent permanent stiffening of their joints as they get older. Next one is communication therapy. It will also help them to develop nonverbal communication skills such as sign language and using visual aids. Also using iPad applications and similar tablet devices may also help them, um, as most people with this syndrome sometimes or often use nonverbal cues or nonverbal communication. They tend to communicate using gestures and signs.
In statistics naman, the worldwide estimated prevalence of this Angelman syndrome is 1 into 12,000 to 20,000, which are confirmed by different studies. Sa Denmark, they confirm 5 patients ang merong Angelman syndrome within 5 years that is year 1995. In year 1996 naman sa Sweden, they confirm 4 out of 49,000 children ranging from 6 to 13 years old ang merong Angelman syndrome. Here in the Philippines naman, the Department of Pedia of PGH was listed 3 patients confirmed by FISH. FISH stands for fluorescent in situ hybridization. Using that FISH technique, nako-confirm nila through visualization kung may absent or may present na chromosome. And then clinically diagnosed of Angelman syndrome. Also to add, may isang confirmed na cytogenetically cased na confirmed dito sa Philippines ng Angelman syndrome. And he is a 4.5-year-old boy. And this came from the case report year 2001.